Hi everyone, welcome back to Rapid Review for MRCEM exam. In this session, we will discuss another SBA question on the topic of pelvic trauma. The scenario may appear similar to the one we covered in the previous SBA practice, but the choices are more trickier. Let's find out whether you can select the correct answer. I will go through the choices again with Sam in a short while. Good luck. Okay, Sam, we have got the next question. Again, it's related to the pelvic trauma. So we have got a 32-year-old male pedestrian who is brought to the emergency department after being hit by a car at around 20 miles per hour speed. On primary survey, there's suspicion of a pelvic injury. The patient's blood pressure is 85/50 and heart rate is 110 beats per minute. No other significant injuries are noted. The question is, what is the most important immediate management? Can you go through the option and tell me which is the correct answer, please?
Yeah, okay, so considering his tachycardia and hypotension, again, I'm worried about pelvic hemorrhage. So I need to keep that in mind, I think, as I go through. So answer A, give tranexamic acid 1 gram followed by 1 gram infusion over 8 hours. So that's, I'm assuming the injury was in the last 3 hours. So that's something I'd definitely want to be doing. Whether it's my most immediate management, I'll come back to this. Option B, perform a fast scan. Again, this could help visualise any free fluid in the abdomen or the pelvis, but it wouldn't necessarily stop the hemorrhage, which is my major concern at the moment. Option C, request a CT abdomen and pelvis. This gentleman, once he's stable, will definitely heading to CT, but we need to stabilise him before we get there. Option D, activate major hemorrhage protocol. So I would be wanting to do this, but again, it's just whether it's my most immediate management. Most likely this gent will need transfusion. And option E, apply a pelvic binder. So pretty much all of the options I think are something that we would need to do, but I think the most important, or the way I think about it, is just turning off the tap. And I think the one out of all of these options that's going to turn off the tap and stop the hemorrhage, hopefully the fastest, is going to be E, applying the pelvic binder.
It's a very tricky question because most of the options will be relevant to the management of this patient, but we have to answer what the question asks. The question asks what is the immediate management. So what we'll do is we'll go through each options again. So the option 1 is give tranexamic acid 1 gram followed by 1 gram infusion over 8 hours. But even though the tranexamic acid is an important intervention in trauma care to reduce bleeding, it is not the immediate priority in this scenario. Stabilizing a potentially life-threatening pelvic injury with the pelvic binder should precede administration of tranexamic acid. Once hemorrhage control measures are in place, tranexamic acid should be considered, ideally within first 3 hours of injury. So I've given the answer now. So your choice of E is the correct. So here the answer is application of pelvic binder, but we are going to go through the other options anyway. So the option 2 was perform fast scan. So a fast scan is useful to assess for free fluid in the abdomen, which is often indicative of internal bleeding, but it does not directly address the cause of hypotension in a suspected pelvic fracture, and especially it does not pick up the retroperitoneal hemorrhage. And when we have got the facility for the CT abdomen, I don't believe fast scan has got any role in the initial assessment of patient with serious major trauma. The option E is request CT abdomen and pelvis. While a CT scan is critical for definitive diagnosis and surgical planning, it is not an immediate intervention in a hemodynamically unstable patient. CT scan should only be performed after initial stabilization, which is application of pelvic binder in this case. And option D is to activate major hemorrhage protocol. Activating major hemorrhage protocol is an important step in managing trauma patient, and especially in this scenario. But as we discussed before, the application of pelvic binder will take priority compared to activating major hemorrhage protocol. Obviously, it has to be done, but in this case, we have to apply the pelvic binder first. And the option A, which is the correct answer, as you have correctly identified. Pelvic binders are crucial for the immediate stabilization of suspected pelvic fractures. They help reduce pelvic volume, limit hemorrhage from the venous and arterial sources, and prevent further injury. Applying the pelvic binder as soon as the injury is suspected is the most important immediate step in this scenario. Even though we had covered the similar scenario in the previous question, I felt we have to do one more just to hammer the point, the importance of application of pelvic binder in suspected pelvic injury. So great, well done, Sam.
Thank you.
And we will meet again for the next session, and we will cover a few more scenarios in relation to abdominal and pelvic injury.